Welcome to our guide on how to reduce the chances of a vaginal tear during vaginal delivery. Vaginal tears can be a concern for many expecting mothers, but with the right preparation and techniques, you can minimize the risk. Let's explore some helpful tips and practices to support a smoother delivery. Understanding vaginal tears. First, it's important to understand what vaginal tears are. During childbirth, the skin and muscles around the vagina need to stretch to allow the baby to pass through. Sometimes, the tissue stretches too far and tears. Vaginal tears range from minor to more severe, with first-degree tears being small and skin-deep, and fourth-degree tears extending into deeper tissues. Knowing the anatomy and possible outcomes can help you prepare better. Perineal massage. One effective method to reduce the risk of tearing is perineal massage. This involves gently massaging the perineal area, the skin between the vaginal opening and the anus, in the weeks leading up to delivery. Here's how to do it. Start around 34 weeks of pregnancy. Use clean hands and a natural oil, like olive oil or coconut oil. Place your thumbs inside your vagina and press downwards and sideways, stretching the perineum gently. Do this for about 5 minutes a few times a week. Perineal massage helps increase the elasticity of the vaginal tissues, making them more flexible for birth. Controlled breathing and pushing techniques. Proper breathing and pushing techniques during labor can greatly reduce the risk of tearing. Instead of holding your breath and pushing hard, try to focus on controlled, gentle breathing. Use deep breaths to help you stay calm and to guide your pushing efforts. When it's time to push, use short, controlled pushes instead of one long, forceful push. Imagine gently blowing out a candle to control your breathing and avoid rapid, forceful pushes. This method allows your baby's head to stretch the vaginal tissues gradually, reducing the likelihood of a tear. Warm compresses during labor. During labor, applying a warm compress to the perineal area can help. The warmth increases blood flow, making the tissues more elastic. This simple technique can reduce the severity of tears. Ask your healthcare provider or birthing partner to apply a warm, damp cloth to the perineum during the pushing stage of labor. The warmth and pressure from the compress help ease the stretching of the vaginal tissues. Birthing positions. Your birthing position can also impact the likelihood of tearing. Upright positions like squatting, being on your hands and knees, or side lying can help open the pelvis more naturally, allowing the baby to pass through with less pressure on the perineum. These positions let gravity assist in the baby's descent, reducing the need for forceful pushing. Discuss birthing positions with your healthcare provider to find what works best for you. Listen to your body and your care provider. Listening to your body and your care provider's guidance during delivery is crucial. If you feel a burning or stinging sensation, known as the ring of fire, this is a sign that your tissues are stretching. Slow down and take deep breaths, allowing your body to adjust. Your healthcare provider may guide you to pause pushing for a moment to give your perineum time to stretch slowly and avoid tearing. Episiotomy. A consideration. In some cases, your healthcare provider may consider an episiotomy, a small cut made in the perineum to widen the vaginal opening. However, routine episiotomies are less common today, as studies show natural tearing can sometimes heal better than a surgical cut. Discuss this with your healthcare provider before labor to understand when and why it might be necessary. Preparing for a healthy delivery. By preparing your body and mind, you can take steps to reduce the risk of vaginal tears during delivery. Remember, every birth experience is unique, and sometimes tearing can occur despite best efforts. However, using techniques like perineal massage, controlled pushing, and warm compresses can help your body stretch and adapt more comfortably. Always discuss your birth plan with your healthcare provider to ensure the safest and most positive delivery experience for you and your baby. Thank you for watching. Wishing you a safe and healthy delivery.